Welcome everybody to our September webinar with Bamboo Health. Thanks for joining us. The name Bamboo Health is new and I'll explain that in just a second. I am Allison Matheson, Senior Communications Manager at Bamboo Health, and I'll be kicking things off for us today. But first, some housekeeping items. So all of our participants are muted, but you can put some questions in the chat. Feel free to drop them in there as we go along, and then I will relay them to our two presenters at the end of the webinar. If you have any questions beyond what is covered in the webinar, you are welcome to email solutions@bamboohealth.com, and someone will follow up with you in the very near future. So we launched the new company name, Bamboo Health, less than a month ago. The company came together as a result of Appriss Health acquiring Patient Ping earlier this year. The former Appriss Health delivered cloud-based care coordination software and analytic solutions focused on prescription drug monitoring and behavioral health and substance use disorder solutions. The former Patient Ping was a care collaboration platform that connected providers to seamlessly coordinate patient care in real time and collaborate on shared patients through a comprehensive suite of solutions. Now the two companies are together as one, bringing the best of both together. We provide one of the largest, most diverse care collaboration networks in the country. Our network enables providers to improve whole person care with a full view of their patient, including both physical and behavioral health, all within the clinical workflow. And our goal is to improve health outcomes and provide more efficient and effective use of resources. And here's our new company mission: to enable customers to optimize value-based outcomes by delivering information, actionable insights, and support for the delivery of whole person care through payer and provider collaboration. This is our first webinar since our new company name was announced on August 31st, so we are happy to have you here with us. Today, our focus is on one of our solutions, PINGS, and how it helped Monarch, a North Carolina statewide provider of comprehensive specialty mental health and human services, better track its patients and help them in their care journeys. And I'm joined today by Deb Daly and Monique Lucas. And before I hand over the reins to them, I'll do quick bios. Deb Daly is Bamboo Health's Product Marketing Manager. Previously, Deb led Patient Ping's onboarding and optimization for health plans, and has held role at Mass Health MA's Medicaid agency, focusing on state strategy for behavioral health and dual eligibles, and she has a degree in public policy from Princeton University. Monique Lucas is the Vice President of Integrated Care for Monarch. With 16 years experience as an RN and 10 years as a healthcare leader, Monique is a subject matter expert in care management and population health programs. She is a board-certified care manager and is certified in care coordination and transition management. She was a pioneer in the development of one of the nation's largest patient-centered medical home programs and has built and implemented various team-based models with a value-based approach in the primary care and behavioral health settings. Over the last 3 years, Monique has led the design and implementation of the first CCBHC in North Carolina, developing an integrated model of care that provides holistic wraparound care for patients that are most in need. So Deb is going to start us off with an overview of PINGS, and then she will hand over to Monique, who's going to show us how she's using the solution and how it's helped her organization succeed. So Deb, I'm going to pass the reins off to you.
Awesome, thanks Allison, and thanks for joining us everyone. So I'll begin with a brief overview of PINGS and spotlights. Could we go to the next slide? Thanks. So together, PINGS and spotlights allow you to track your patient's care events in real time and understand trends in your patient population over time. So what that means is when one of your patients has a care encounter on our network, in other words, if they present at the ED or are admitted, discharged, or transferred from a hospital, you'll receive a real-time ADT notification that we call a ping. Each ping contains key information about the event, including the event that occurred, the facility, and the diagnosis if available. Alongside that ping, you'll also have access to longitudinal encounter history for that patient, care team info, and updated patient phone numbers. This ADT data also powers the Spotlights product, which provides real-time reporting dashboards, including key metrics like ED utilization and readmission with drill-down capabilities to individual patients. Next slide, please. And so the National Bamboo Health Network powers both PINGs and Spotlights, meaning that you'll receive data from thousands of acute hospitals and post-acute providers nationally. We also offer multiple data delivery options, so users have the data when and where they need it in their workflows. So the three main options we offer are our intuitive web-based platform designed to reduce detective work, customizable email and text alerts to enable seamless workflows, as well as a range of integrations and data feeds. So given all of those capabilities, PINGs and Spotlights can drive a wide range of use cases and workflows for a wide range of providers. A few common use cases for community behavioral health orgs like Monarch include coordinating care with the ED or acute setting to ensure appropriate care transitions for a shared patient, following up with patients after they've had a care event, coordinating and managing a patient's longitudinal care with other community providers, and leveraging the data to conduct analyses leading to operational insights. And so with that overview, I'll turn things over to Monique, who will share how Monarch has used PINGs to date.
Hi, everyone. How are you?
Good. We can hear you.
Okay, great. Can we progress to the next slide? All right. So just to give you guys a little bit of a backdrop and outline of what Monarch does, we currently serve North Carolina population, and we roughly serve about 28,000 people annually with intellectual developmental disabilities, mental illness, and substance abuse. Through our CCBHC grant in our Stanley County location, we've been luckily enough to have a CCBHC grant to support an integrated model of care. With that model of care in our location, we serve about 1,400 patients there. All right. So at Monarch, you know, we operated fairly similarly to most other offices. And once we were posed with this grant, you know, there were certain regulations that we needed to abide by. You know, we needed to be able to follow up with patients, provide coordination, have different collaborations in place with our hospital partners. And while we have tried to put these relationships and processes in place, because we had no active notifications of when our patients were actually in the hospital, our follow-up was typically a little bit later than what was expected. We never knew when our patients had been in the hospital. The only time that we would find out of a hospitalization is if a patient reported it. In that case, the patient is coming into the office possibly 30 to 90 days later for a medication management follow-up, and that's how we were finding out. So we were not really sure what we were going to do as an agency to meet the requirements to be able to track and provide follow-up and coordination. Luckily, one of our hospital partners here in North Carolina connected us with the PING team, and at that point in time, we thought that this may be a solution to help solve the problem that we had at hand. All right. So with CCBHC definitely being a new approach to care, this was our first time working with a large federal government grant, and essentially we had 4 months to comply with all of the requirements needed to become a certified clinical behavioral health clinic. And essentially what that is an integrated model of care that supports a whole person wraparound care. So whereas other practices were providing medication management and therapy, we also had additional enhanced services that we had to offer, such as match programs, coordination of care, peer support, care management programs, and we were tasked with treating folks with co-occurring disorders. So we had a lot of work that we had to kind of put in place in addition to figuring out, you know, how we were going to track and follow up with our patients. Next slide, please. So our PING implementation, initially we had some small challenges with getting started with PING because we are a behavioral health agency. So, we've got different protected classes of patients that were of concern. And luckily, PING was able to work out the kinks and offer us a platform that had the protection that allowed us to utilize the PING solution. So our implementation started with roughly about 1,500 patients. We wanted to see how this would work. The thought and the idea of it sound great, but would we be able to operationalize it? Would this be something that would be scalable and could bring benefit to the rest of our agency? And lucky for us, we had our grant, so we were able to trial this out with a small population. After about a year in PING, we quickly realized the value that it brought. We were able to utilize the data to build different dashboards, which ultimately gave us a much clearer picture of what it was we were dealing with and how to handle our hospitalization population. Additionally, as part of the North Carolina Medicare transformation, we're going to be participating as a care management agency. And with that, one of the important requirements is to follow up with post-hospital coordination and follow-up. So in the past 6 months, Monarch has engaged in a larger contract and expand our PINGs to cover all 28,000 of the lives that we support, which is pretty exciting. We were able to be in a very protected pilot state and put together our workflow, create SOPs, create that data dashboard. So once we went live with the entire population, it just rolled right in. Things were very easy to adapt and to get folks used to. Next slide, please. So how are we using PING data? It was great that we had a tool to support us operationally, right? Now we had a way for our care managers to know when our patients were in the hospital so that they could follow up. But we decided that we really wanted to take patient PING's data to a whole nother level so that we could look at things from a population view and be able to see, what was really going on across our agency. So we utilized Tableau to build a dashboard with the data that was exported from patient PING, and it really opened our eyes to a lot of things that we hadn't realized. Next slide. So just a sample of some of the information that we were able to gain by using PINGs and converting this data into our Tableau system. We could see our total number of hospital visits across our agency. We could filter these hospital visits by location. We could look at average length of stay, and again, that would filter as well with hospital visits. We could see the number of PINGs by month, and you can see how our numbers quickly increased there in June once we went live with the entire agency. Also looking at a total count of visits by setting. So how many patients are we looking at in the emergency room versus patients that are actually inpatient? And then looking at skilled facilities as well as observation visits. We also had some breakdown of suicide-related visits so that we could see specifically how many of our patients had hospitalizations related to suicide. Next slide, please. So as part of our inpatient hospitalization drill down, it was great to have the numbers of hospitalizations that were happening, but we dug a little bit deeper so that we could see inpatient hospitalizations broken down by individual programs across our agency, as well as inpatient facility utilization. This helped us to see where we had folks that were actually frequenting certain facilities so that we could build different relationships to support better transitions of care for those patients. Additionally, we included some inpatient insurance utilization just so that we can see what population of patients were frequenting the hospital. Next slide, please. So looking at our facility tracker, we've looked at the different facilities that we utilize, and we can look at facility visits over time and kind of break down where our patients have been. So if you kind of take a look at this map, those blue dots indicate the hospitals where our patients have actually been pinged. You'll note that there's quite a few hospitals that are not within North Carolina State, which is actually pretty cool that we can follow our patients and have that type of insight to where they are and what they need, even when they're outside of the walls of our state. Next slide, please. So once we got that basic data, the next thing that we thought would be cool to dig into is integrating some of that data. So taking the information that we were getting from patient ping and now looking at those patients who had pings and evaluating their primary diagnosis that was documented in our medical record. So by doing this, we were able to look at the number of visits broken down by primary diagnosis. If you look at the chart on the left-hand side, you'll be able to see a breakdown of disorders and the total number of hospitalizations that we as an agency have had. So this became very relevant to a lot of things that we were looking at. You know, if we're looking at our high-risk populations and we're looking at our patients who need the most support, clearly this data is telling us that most of our patients with schizoaffective disorders, bipolar type, those are the patients that are frequenting the hospitals more. We also have a breakdown of types of visit. So whether it was an ER visit or an inpatient, broken down by diagnosis as well. Next slide, please. So to take it a little bit deeper and really see what we're working with, because you know, schizoaffective can be a rather large diagnosis. We were able to create this view where we can dig in even deeper. So by clicking on these different colors on the graph, it will drill in and show you how many visits specifically for the diagnosis and drill down by ICD-9 code. So again, just giving us a clearer view of the populations who are frequenting the hospital and could potentially need stronger care plans, additional support with care management, and additional support with transition management across the board. Next slide. So hospital follow-up. This was a big one, because not only were we expected to do this for a CCBHC grant, but many of our payers were starting to talk, you know, risk-based contracting, you know, value-based care. So with this, we wanted to take a look at how many patients we were able to provide follow-up within 7 days. So all inpatient stays, and then the number of patients we were able to follow up in 7 days. You can see that we only had 33.3% of patients that were followed up within 30 days. But if you look to the right, within 30 days, all 15 of those patients who had an inpatient stay had been followed up with. So while that doesn't necessarily meet the requirements for our insurance company, it shows that, you know, we are making best efforts and getting patients back into care within 30 days. All right. So with patient ping, you know, the data is great, but I think the best component of being able to utilize this tool is to be able to be available for folks when they need you most. When somebody's in the hospital, they don't necessarily think to reach out and call somebody for help. But now, thanks to Ping, we are able to know when our patients need us to reach out to them. So one experience that we had that kind of sticks with me, we had a young woman who had recently lost a son about a year prior to the event, and had been working very closely with us. She was on medication management. She was working with a care manager. She was working with a peer support. She was also doing group therapy and individual therapy. Well, she was progressing well and things were good. But, like most patients or like most agencies, as we start to take care of patients, they get better and they start to fall off of the radar. So as she progressed and as she got better, the less services she was involved with. Well, fast forward to 12 months later, she was doing well. Things were okay. But it happened to be her son's death anniversary, which she happened to take pretty bad and end up in the emergency room. So pinged us and let us know that she was there. And when we reached out to her, she burst out into tears and was thankful that we were able to reach out. She needed us to call her. She needed us to re-engage her in care. And had we not had that insight, we would not have been able to be there for her at that point in time. So, that speaks volumes to the amount of the quality of care that you can provide to your patients. And they could really depend on you in their time of need.
Well, thank you so much, Deb and Monique. We do have a little bit of time for questions. So if you have them, you can put them in the chat box. I do see at least one that we can do first while everyone else is formulating some questions that they might have either for Deb or Monique. So first question I see is, how do the pings integrate with your care manager's workflow and your care management platform?
Yeah, so our pings are not integrated with our platform. Unfortunately, we have to go into patient pings separately to resolve pings and see them. Fortunately, Ping does have the ability to send emails or text alert in real time with the filter capability for you to be able to filter what times you want it to be alerted. So each individual care manager can create their own filter to receive their patient notifications. So for our care managers, they create those filters so they get notifications for their assigned patients. Additionally, we utilize patient ping to identify patients who are hospitalized, and we discuss that on a daily clinical huddle. Where the care managers discuss patients. If it's a patient that has not been incorporated into care management, it's somebody that we look at to see if they may be a good component to add to that. So that is essentially how we are using it. Real time, we get the alerts, we document, the ping is resolved or with the follow-up in ping. And then for our agency, we complete a hospital tracker, and that hospital tracker really captures all of the details that support that hospital visit.
Great. Another question, what ways have your relationships changed with other healthcare providers since adopting pings?
So it has definitely helped us to identify who our key partners are, right? So now we know where the bulk of our volume of patients are going, and that gives us a little bit more insight into who we need to build relationships with. You can't do transitions of care if you don't have relationships with the facilities who you're trying to transition through. So this has given us at least a great insight for us to figure out where to focus our resources and build those relationships to coordinate better care.
Awesome. So I have a question actually. That patient story was really impactful, Monique. I'm wondering if you can share any other examples of how PINGS has impacted the patients in your population.
Yeah. So I will tell you, we've had a little bit of a mixed bag. You know, initially when we started with Ping, we would call some patients and they would say, I mean, how do you know I was in the hospital? Or, you know, what did you necessarily, I don't need any help. Why are you calling me? But it's the majority of the patients who were able to connect and re-engage into care, or kind of pull that hospital team into the patient's current level of care. So one example that we had was a patient who was participating in our MAP program. The patient was in our MAP program and had been doing well, and unfortunately fell ill and went into the hospital. Now, this was a physical hospitalization. So, you know, in typical world, we wouldn't be worrying about a physical health hospitalization because we're only required to follow up on behavioral health hospitalizations for our value-based contracts. But, you know, because we got this ping and we had a care manager follow up with this patient, we knew what was going on, and that patient's MAT treatment did not have to stop. Our psychiatrist was able to communicate with the doctors in the hospital so that we can continue care, and there was no break in that continuity of care. I think that is another component that's wildly important, because how many times, I can't tell you, that a patient came home from the hospital, you know, on a brand new medication regimen and had no idea how much work we had put in to try and titrate and get that patient to the right dose. And, you know, just that quickly, things can be reset. So I think being able to have that insight for our providers to communicate for continuity of care is also an awesome example of how Ping has helped us with our patient population as well.
Well, thank you so much. I don't see any more questions right now in the chat. Oh, actually, hold on. One more came. Let me read it really quickly. The question is, who can ping the care team? The patient and anyone on the care team, and how do you follow up on the pings?
So the ping actually comes from the facility that has a relationship with Bamboo Health. So if they're under contract and an agreement with Bamboo Health, then those facilities enter that information into their system, which then alerts us as the additional party that that patient is in the hospital.
And one more came in. Can this be used to notify primary care prescribers of non-fatal overdose via PMP programs? I don't know if that's a question for you or Deb.
Yeah, maybe Deb. I know for us, the challenge is, out of all of the data that we look at, we typically can identify about 20% of the types of hospitalization. So if it's a physical health, behavioral health, the information that's put into the ping is really dependent on the information that the hospital or provider actually enters into ping. So sometimes they enter that information so you would possibly know that it were related to a suicide event, but sometimes that information isn't captured. So it gets a little bit tricky. So I'm not sure that I would utilize that as a catch-all for that type of data reporting.
Yeah, I can jump in here as well. And Monique, you said it just as well as I could have. So yeah, the data that is coming through for pings is slightly different from in a PDMP, but it is a use case, you know, that both products kind of support. We can absolutely take that offline and add more detail as well.
Great. And I had one more, and then I think we're about at our time. What was your approach to getting your local providers to join Bamboo Health to support what you were doing, and what's the value for the provider? So Monique, I think you could probably address number one with getting other folks to join into the network. I think you actually joined because some other folks in your area were a part of the network, correct?
Yeah, so to be honest with you, we didn't really have to do any of that work. Bamboo Health did all of that legwork for us. We definitely shared the solution that we were utilizing, at any opportunity that we had so that we could get other folks to engage and benefit from what we found in this platform. But Bamboo Health did an amazing job at capturing majority of the providers across our state. Just to show, when we first started with them, they had a handful of providers who were not engaged. And by the time we signed our contract 1 year later, all of those providers who we had in question were signed on and in a relationship with Bamboo Health. So that was extremely easy on our end as a provider.
Great. Well, I think that is the end of the questions for now. I see a couple others that we'll respond to offline. I'm going to leave you guys with a quick poll in case you want to engage with us any further. So I'm going to launch that. But thank you so much to everyone who came. And if you have any questions, you can email solutions@bamboohealth.com. And thanks so much for coming today.